I decided to do this art installation because the number of COVID deaths throughout the US became so large that even I couldn't comprehend it. I wanted it to be reflective of Arlington Cemetery because that's where we've buried those who've protected us, and this is where we are honoring those whom we have not protected. This is a living memorial to a living tragedy. One unit for every single life. When I started this project, I bought 250,000 flags. I thought that would be plenty. And we're already blowing right past that. We've had to expand. We had to what I call break the oval because there was just no more room to place flags. So now we're placing flags on adjacent green spaces. In just 5 days, the death toll has increased by over 6,000. That's the equivalent of 2 9/11 events. How many more 9/11 events are we going to have before we can get this under control?
I work in pediatrics. People think that kids are immune to the disease. They're not. We've seen them get it. We have also been floated to adult ICU units. We are the ones who get to watch your family member die and then clean them up after. We hear their last words. Some nurses are told to deliver their last message to their family. In El Paso, where I'm from, they're at 100% capacity, and they rolled in morgue trucks. I have friends who are nurses down there, and one just said the other day that she feels like she's going to hell every time that she goes to work. And it does feel like that sometimes. People die alone, intubated, and tears coming out of their eyes. We end up having PTSD from it. In just this time with the virus, we've had a lot of healthcare workers committing suicide because of the weight of all of it.
I am here today to do our pastoral prayer. We quickly moved our worship service online so that people wouldn't risk being exposed. Lord, we come into your presence, our hearts broken by the death that is rampant in America, with hearts seized with fear for the ways in which we don't even know how to talk to one another anymore. This day we remember our own member, Bob Hughes. We add a flag with his name on it to let his living be a blessing, to let his dying be a lesson.
There's just no way to personalize over 250,000 flags. People simply come. We have clean flags available for personalizing and planting.
Put the name, whatever you want on it, personalize it.
Thank you. I have family members that have been infected with COVID, and I have a close friend of mine whose mother just passed from COVID. I'm planting a flag for her mother because she can't make it out herself. She's been sick herself, taking care of her family.
There are some beautiful messages about what loved ones meant to the family members. The one I love the most is the one where the woman's picture is included, because that truly humanizes that family's loss.
The number one thing that they say when they're in the hospitals, oh my God, I didn't think it would happen to me. It can happen to me, it can happen to you, it can happen to your baby, it can happen to your grandmother, your father, your child. It's a non-discriminatory virus. We have people that don't have great immune systems. Some people that have gone through chemo, horrible cancers, and they've been able to surpass them and beat them, and then to catch a virus because somebody was careless.
I am a breast cancer survivor, so my immune system is not as strong as it was before, so I don't want to get sick, and I have 3 younger children who I don't want to possibly get sick or catch COVID. I have a friend right now who's in the hospital. He has COVID and he had pneumonia, and he's currently not doing too well. He's the same age as I am. He's in his 30s.
It is a mandate from God that we wear masks. One of the things we Christians believe is that we're called to love our neighbor as ourselves, and the best way that we can show our love of neighbor is to wear a mask because it's protecting other people. So choose life and wear a mask. Gets your glasses a little foggy, kind of inconvenient, but I mean, look, how many people would not be dead if people had worn a mask? Far, far fewer. This is a place for us to be convicted about wearing a mask.
For people who say it's uncomfortable, look at it this way. Surgeons doing heart surgery can last 12 hours in a mask. Us nurses, we wear more intense masks than these right here, and we're wearing them our entire shift. If I can do it, if they can do it, you can do it. For at least 1 hour while you go to the grocery store. We advocate for you. We fight for you. With people not wearing masks, they're fighting against us. It's not about red or blue, right or left, Trump or Biden, or any other political party. It's just being a good human.
We could save tens of thousands of lives if everyone would just wear a mask for the next few months. Not Democrat or Republican lives, American lives.
I let my guard down. I made a mistake. I was wrong. And I'm fortunate to be sitting here this morning in good health. We need to be telling people that there is no downside to you wearing masks.
We must have no stigma, none, about wearing masks.
Vaccines are going to have a major positive impact. The cavalry is coming here.
If you're fighting a battle and the cavalry is on the way, you don't stop shooting. You keep going until the cavalry gets here, and then you might even want to continue fighting.
It's more important now than ever that we double down on mask wearing and physical distancing to help more people get through the winter and protect the brave men and women serving on the front lines of this crisis. Our doctors, nurses, grocery store workers, and truck drivers.
Mask up, Kentucky.
Mask up, Wisconsin.
Mask up, Illinois.
Mask up, Ohio.
Mask up, Indiana.
Mask up, Minnesota.
Mask up, Michigan.
Finally, let us remember how small our differences are in the face of this shared threat. In the final analysis, we are not partisan combatants. We are human beings, equally vulnerable and equally wonderful in the sight of God. We rise or fall together, and we are determined to rise.